Welcome once again to the Radical Imagination Real Talk in the Hamptons. I'm your host, Jim Vredos, and on this segment, we're going to be talking about social medicine activism in the Hamptons with Dr. Daniel Van Arsdale, who's the Director of Educational Services at Stony Brook Southampton Hospital. And I'm so pleased, first time we've met.
Yeah.
I'm
Thanks for
so
having me. Thanks for
pleased
having me.
to hear and talk with you about the incredible involvement you're having in this community and making such a difference. You are getting out of the hospital,
Yes.
out of the doctor's office,
Yep.
and into where? Social medicine. What is social medicine?
So, I think one of the things that as physicians we are not taught is how important it is to be outside of the four walls of your office. If you limit your influence to the four walls of your office, you are necessarily limited by the people who can afford to see you, who have healthcare coverage, who can afford to get to you. And if you really want to create a health impact, your influence can't be limited to your office. You've got to go out into the community. 60 to 70% of healthcare outcomes are driven by things that happen outside of the doctor's office, outside of the office visit.
What do you mean by that exactly?
So about 20% of what I do in my office, the prescription I give you, the diagnosis I make, that drives about 20% of healthcare outcomes, right? The rest of it is really driven by where you live, what you eat, what you're exposed to. Those are the things that really create the healthcare problems that this country deals with.
Your life chances, your housing situation, your
stress level.
stress level,
Yeah.
education,
Yeah.
problems with all-
Transportation.
exactly.
So I remember reading years ago, there was a little case study. They said, who would live longer? The stressed out CEO who smokes and drinks, or the person who sweeps the floor, who smokes and drinks? And the answer is the CEO lives longer. Because
Is it about almost 7 years now?
it's
The age
it's
differential?
quite a lot, actually.
Unbelievable.
It's quite a lot. And the reason is because that person, that CEO, for example, has agency, has power, is not under the stress of not having say in their life. And and there's lots of other things that can contribute to poor health outcomes, like you're talking about housing, or poor air quality, or not having access to food, nutrition. We know that early childhood interventions with food, with education, all those things drive good health outcomes. And when they are not there, you get bad health outcomes.
Interesting.
So as a
Yeah.
physician, if your interest is in the health of your community, it's a strong word, but it's almost unethical to limit yourself to the people who show up at your office, because in many ways they're privileged. You need to go out and find the people in your community that are suffering. And you wouldn't imagine driving around this area, but there are a lot of people who need help.
Before we go drive around
Yeah.
this in the area, I've got to ask you personally, where
Sure.
did you become so radical here? This is, no, come on now. This is progressive, whatever you want to call it.
Yeah,
This is outside
Yeah,
the
so
box that you're been taught.
Yeah, so-
Although maybe medical education is changing these days.
yeah, so I didn't always want to be a doctor.
Okay.
So the arc of kind of where I landed here was, I started out, I went to college, and I was a comparative religious studies major.
This is up in
Massachusetts. And so my thought was that I was going to be going that route. And
Divinity student.
I thought I was going to go that route.
Okay.
And then things in my family life kind of altered my direction. My brother was really important in that. He's a lawyer, so he was very analytical and kind of talked to me about, and he said, what about medicine? It seems like you would be really passionate about helping people. And then you get into medical school, and you're really what's kind of, throttled down your throat is what's most important is that you know a lot, and you make a correct diagnosis. Okay. And that's
Keeping it
important.
No, no,
And that's
absolutely.
important.
It is important.
But
certainly.
after you learn a lot and you make a correct diagnosis, right, and you treat the disease, what are you left with? A person. And that person, right, is really very important. And what's important to that person and what matters to that person and what motivates that person and what will move that person to do what you are asking them to do to get better is equally as important as your ability to write the script and make a
And you
diagnosis.
can't cover that in a 15-minute
You can't.
session
You can't.
with a doctor.
You
I mean,
can't.
however
Yeah.
good you are.
Yeah, and one of my professors once, I remember, years into practice, we were out to dinner, and I was really frustrated talking about, I'm trying to get people to quit smoking, I'm trying to get people to eat right, I'm trying to get people to get the medicines that I prescribe for them. And, after a bit, he put his hand on my arm and said, Dan, stop. He said, doctors do two things. They cure and they care, and most of the time, they just care. And that kind of shook me a little bit, and I said, what does it mean to care for another person? Like, what does that mean? And how does that manifest in your office visit, or how does that manifest in, our community? What do you need to do that? And you're right, the 15-minute office visit is tough to get all that done, let's
Because
say.
you got a waiting room out there full of people.
Right. There are some obvious
Places.
things, yeah. And so, I started to think more about, and it kind of slingshotted me back
Community.
to my time as studying religion, is that,
Right.
you need to know people. You need to understand people. If you want to change somebody, you need to know the things that are important to them. If you want to influence another human being, you've got to understand what their needs are. And so, and we're not taught that. We're not taught about, what drives human behavior in medical school and how to influence another person to create the change that they want to make in their life. And once again, I mean, if you were taught that, we would be much more effective within the four walls of our office. But once again, there are people who are never going to come into your office that need help. And so that's the thing about addressing the social determinants of health, figuring out people's needs in the community. And so that's where you got to get out. You got to see it. You got to live it. I'll tell you, I remember once I was at a local food market, and I just seen a patient that morning, and that afternoon or evening I was shopping, and the guy who came in was kind of dressed like me. He drove up in a canary, a yellow Porsche, and I saw him in the supermarket, and I saw him go get in his Porsche, and he drove away, and he drove right across the street into a mobile home, where he parked his car and walked into his mobile home. I remember saying to myself, I wouldn't know that was his situation by how he presented to my office, that where he was living and more about him. So I lacked understanding because I wasn't in the community, meeting people where they were. And asking questions about, where do you live? Who do you live with? What's important to you? What do you do for fun?
And this is so
And
unusual.
that's just the beginning of it.
No,
That's just
but
the
it's so
beginning.
unusual because usually the people who aren't able to come to your office have a certain suspicion about the medical field. They really don't feel that they care for them that much.
Right.
As most of the other institutions of society don't. So they're reluctant to even, they're not gonna do much for me anyway, they don't really care. So I will just add a sociological piece of data. Approximately 250,000 people a year die from what's called structural violence.
That's right.
It's incredible. So poverty and stress and so on, all those things you're talking about. So concretely here, you go to where and who?
Right.
Where would you like to start? Maureen's Haven, do you work with them?
So it's interesting. So really this year, we started looking at really having a much greater impact than we've had in the past. And so we've started reaching out to many of these organizations, from Project Most to Maureen's Havens to the Retreat,
Just briefly for our audience, just what is the most, or what's the retreat? Just
So
tell us
the
a
retreat,
little about what.
right, so
what
the
these
retreat is an
positions
organization that deals with domestic violence.
Exactly.
And Project Most is a child care, organization. Maureen's Haven deals primarily with homelessness and things like this. And so we've had some conversations with them to ask them, what their needs are, how we can help, how we can support. It's my feeling that, we can and should be the glue that connects these organizations together, and that as physicians we have a voice and we have a skill and we have a passion for people.
And you train other physicians at Southampton, Stony Brook in this, you can't be the only one running around to all these people.
No. So
So you have
over the last
Yes.
Decade,
I see.
we've kind of grown a group of people who are similarly passionate about this. And so, this is nothing you do alone. I mean, I'm sitting here with you, but this is not a one person show.
I understand.
So absolutely, you need a team to be successful, for sure.
So tell us specifically, you will contact the organization and tell them what you can,
Ask them,
ask them what they need.
what are the issues?
That's where you start.
Yeah, what do you, if we can, how can we help? How can we kind of change the narrative,
Rather than coming in there and saying, this is what I can do for you, what
What
do you need us to do
do
for
for
you?
you? Yeah. How
Very
can-
important distinction, right?
Yeah, how can we support your organization? And then, when you find a need, then what do you do? When you find a need, what do you do? And so, one of the things that I'm, constantly, I mean, even yesterday, I learned about a new organization that helps with substance use and overdose, preventing overdose deaths, that I hadn't known about. And this is wonderful, for people who are vulnerable or people who have substance use disorder. We can connect these organizations so that we are helping people, where they're at and preventing preventable deaths. And
Do you connect with the police? Because they're often coming in
they're the
contact.
first.
They're the first.
A lot of times they're the first to a crisis
dump
anyway.
all this stuff on them.
Yeah, we have not connected with the police.
You have not.
Not yet. I mean, through other kind of community organizations, yes, but not directly with them. But they have a heavy, police departments out here have a heavy lift. They're asked to do a lot of work. They're asked to be social workers. They're asked to be
Well,
enforcers of.
but
Yeah,
isn't that
no.
why they would
That's
need
right.
you?
Yeah.
But then if I may, I think it's a very, defund the police is just a stupid phrase.
Defunding any community organization that helps that community stay
Yeah.
safe, stay healthy, is
But most
absolutely
of
ridiculous.
the police, because I did teach John Jay College of Criminal Justice, the police do want the help.
Yes.
They would welcome it. The corrections officers need it. They are not, I think you would have a dramatic reduction in the violence that's going on in the prisons. We're putting very troubled people in these facilities, and these correctional officers are going crazy themselves and not equipped to deal with it. So we do need you so
Good
much.
stuff. Yeah.
And
Yeah.
so you find pushback on, well, thanks, but no thanks, but where are you welcomed? And
Yeah, no. I mean, I think I haven't had a community organization ever say thanks, but no thanks. I think the truth of the matter is, particularly now, with
Yeah.
many of these organizations rely on federal grants, right? And they have been wiped away.
already.
Already.
More in the future.
Already. In fact, some organizations, there was an organization that I recently heard about in Nassau County that lost their federal funding and had to shut their doors. And that organization was also dealing with domestic violence. And so now we've got people, kids and women who are being abused that have no place to go there. And so it's
heartbreaking.
It's heartbreaking.
And more than that.
And it's totally preventable. It's
Preventable
totally
is right.
unnecessary. Yeah.
That's what structural violence can be.
Yeah.
And going back to your divinity training there, when you so eloquently said, learn to care. We are in a political regime that doesn't care. Let's be honest about it.
It's
Let's
my,
not
it's
pussyfoot
my
around.
opinion, they do not care.
They really don't. Now, for whatever reasons, whatever problems they may have, the bottom line is they don't care. So,
Yeah, I mean, so my thought is is don't tell me what you believe. Show me what you do, and I'll tell you what you believe. And what
yeah.
the
yeah,
current climate is, what they're showing me
Yes.
is that they really don't care about people who are vulnerable, people who need help. And, you know, I'm a veteran, and it's impacting veterans,
Yeah.
which I think is just horrendous to do that to people, cut funding for people who served. And they're doing it to, well, they're doing it to children, they're doing it to everybody.
All kinds
All
of
kinds of
vulnerable
people, vulnerable
populations.
populations that don't have a say or who are disenfranchised in some way.
And pitting people against each other. That's
Mhm.
how they can get away with it too. Well, yeah, of course, who wants to deal with these people? They're gonna be troubled, they're violent, we need to put them away, we need to deport them and so on. So you work with the immigration groups, through OLA, right, Minerva?
Yep, OLA,
Yes.
yep. Minerva, she's come out and talked to
Yeah,
our organization.
she's terrific.
And she's someone who we're very much interested in working with as well. So, so there's a lot of people doing amazing work. And, you know, each of us in this community need to support those people. And we want to play our part as much as we
Yeah.
can, as much as we can.
In
as
talking with you on the
physicians.
phone, tell me about the homes you're working with autistic young people.
Yes, so Lisa Liberatore, she's a physician, and she has a son who has autism, and she has an organization that, you know, once you reach a certain age, you kind of age out of the system, right? And so you have adults that have autism
Yeah.
that don't have a place to go. And I believe John Kasich, who was the governor of Ohio, just wrote a
Yes.
book. I think it's called Heaven and Us, something like this. And he actually highlights her organization about, you know, a person who just persevered to start an organization to serve a community of people who were in need. And right in Southampton, she's got a number of residences where.
It started up in New Hampshire, you were saying? Or-
No.
No, it started here.
I think, yeah, it started
I see.
here. They sell, actually, I think they sell a granola called Love
That's-
Michael.
right.
I believe I've seen it in Trader Joe's, I'm not sure.
And
I've
at
seen it in the
farm
stores.
stands.
Yeah, and in the farm stands, I've seen it
Yes.
certainly there.
Yeah.
And she does this amazing work. And so when I found out about it, I talked to our CMO at the time, this goes back several years, and I said, I want to be able to provide medical care because a lot of people are uncomfortable around people who are disabled, who have you know, any kind of issue that it troubles them, whatever that may
Yeah.
be. And so they avoid, physicians, when they feel uncomfortable, they may avoid or not look for things that they should be looking for in a particular patient population.
Mhm.
And so we wanted to train our physicians about, you know, this is how you care, this is what you need to do for this patient population. So you don't miss something, because they won't tell you. You know, people who are severely autistic may have pain, may have problems, but they may not be able to verbalize it to you. They may just get agitated. And a physician may just see that as part of their diagnosis. They're just agitated, whatever it may be, and not dig further. And I tell everyone that I train, I say, what's the most common reason for missing a diagnosis? And not ordering a test. I'm like, no, finding one. You find a diagnosis, and that's what you hang your hat on, and you dig no further.
Mm-hmm.
And so, you know, you always need to play this game with yourself. You know, someone has a cough, oh, you must have pneumonia. And then there's
A lot of
some,
misdiagnosis.
yeah, and then you
right?
have that angel on your shoulder saying, it is absolutely not pneumonia, what could it be? And so you have someone who's agitated or whatever it may be, you know, you gotta keep on digging. And so that you don't miss something, particularly with in certain patient populations, you need to do that. But Lisa does amazing work. I mean,
Yeah.
she's a force of nature.
We have to meet her. So they have a series of how many homes?
You know, I believe it is 3 at this point.
And how many what's the
What's
situation
the
there?
situation? Yeah, so it
People-
looks like a private home, and these things they're not institutionalized. They're like, looks like a private home. And so people, the clients that are in there have bedrooms, and they wake up and they have a routine, and they have people there that help them with
About
caregiving.
how many people per house?
Depends on the size of the house. I'll say 6 to 8.
Yeah,
Um,
that's a
Yeah.
good size.
yeah, and
I think I mentioned to you, I was a live-in counselor for ex-state mental patients in Boulder.
okay.
And we had about 6 people at a time.
Yeah.
So they
So, and
stay there,
and they
live
and-
there for,
yeah, and they stay there and they live there and they do things and
develop friendships.
yep, they
and
become part of the
connections.
community. Like I see them at the July 4th parade every
They
year.
work and-
Yeah, last week we went to a movie in Southampton. The new theater opened up there, and they were there. And
Do some like move out and establish their own residency, or is this,
no, I think it's where most of them
Most will stay.
Will stay. Yeah,
I see,
there's a certain level of care that's provided there, and so
right.
we provide medical care for them,
Yeah.
and it's been a blessing, honestly.
That you said you're getting also involved with some of the drug overdoses and
Yeah.
suicide people. Now, you have background in psychiatry, or do you? Or-
No,
No,
well, my
you have people that are
yes,
psychiatric,
yes, with the.
social workers
So
or?
so ELI, Eastern Long Island Hospital,
Got it.
they have a residency in psychiatry. They do a lot of addiction medicine. Dr. Jared Pachter is gonna be starting a addiction medicine fellowship. We get training in medications for addiction, for keeping people from, it's risk reduction to keeping people
Yeah,
alive, basically, right? You know, and so that's what we kind of do, but I don't have an addiction practice.
Right. I know there's a lot of work in the city on people actually looking at the drugs that people are having, making sure it's safe,
Mhm.
these safe houses and
Yes,
so on. I don't
yeah.
know if that's something in the works.
That's not something that we're involved with, but
Yeah.
there are community organizations that do all that stuff.
What about the schools, the high schools, the churches, the synagogues?
Yeah.
The pastoral counseling is good up to a point, right? Then there's,
And you need psychologicals, yeah. So it's interesting, the Orthodox Church in Southampton, the
the Greek Orthodox,
Church, yeah.
yes.
There's a group of people there who are very passionate about mental health services on the East End, and they're actually calling together a meeting of organizations to kind of talk about that and strategize. And once again, it's community organizations coming together with a healthcare provider. In this case, it's Stony Brook Southampton.
Sort of an umbrella
And to kind of,
organization.
what do we need? What are we seeing? How do we address this? It's gotta be a team approach, and you can't wait for it to come to you. I can't sit in my office and wait for someone you gotta address it where it is. Because they're the community organizations are the first line of defense. They're the ones who are gonna see it first, smell it first, feel it first, before it gets to me. I think about it, by the time I get someone who's been diagnosed with diabetes, or I diagnose them with diabetes, their physiology has been struggling for, decades,
So you have
and so-
nutritionists.
And so,
Also,
yeah.
yeah,
Oh, sure, I mean, yeah,
full-
but what I mean is that,
Yeah.
getting, it is critical to get these things before they become full-blown problems. It's critical to kind of get at the beginning of it and cut it off at the pass if you can. And that's why, nutritious food is so important. You can prevent a lot of diseases. I call them lifestyle illnesses, really. Most of the diseases that we talk about today aren't really diseases, they're lifestyle illnesses. They're choices that we have all made throughout our lives that have led to these things, and/or they are a result of living in an environment where we're ingesting plastics, or we're drinking water which isn't clean, or we're eating food which has been which isn't clean in some way. We're polluting ourselves. We definitely are doing that, and I think all those things just add a physiological load to our bodies, and our bodies are incredible. But at some point, they start to break under the pressure either what we're doing to ourselves or what the world is doing to us. And so,
And some earlier than others, and that's the key.
yeah, some earlier than others, yeah.
And that's the key, to try to get in there early enough, I guess, in the elementary schools.
Yeah.
As well,
Mhm.
working with the teachers, the nutritionists there, and these early signs of trouble in the household. It's a monumental task that
It's a
you're.
monumental task.
It really is, and we're not even, you could talk about it among the rich too. I mean, there's enormous,
That's
it's
right.
not just, the poor, working class.
That's right.
The rich also have a multitude of issues and problems,
Yeah.
and often go untreated, and, well, we have a couple more minutes, I will just mention, look, I think, the uncaring that we can measure the Trump administration, or Trump himself, in his policies, comes from a very brutalizing, traumatic childhood. And we can say that about a Hitler, okay? So all these authoritarian, a lot of people need the services, let's put it that way, let's
yeah.
leave it at that.
Yeah.
And that you're offering, and I think the way things are going, more people will need it than ever. So the last minute here,
Sure.
you have the last word here on this, and it sounds like, how can people find you, and if they need to get in touch with Southampton, your programs and so on? Well, but again, it's not, it's you reaching out, but people who want to reach out to you as well.
Yeah, that's a great question. So, clinically, I work out of an office in West Hampton called West Hampton Primary Care.
Okay.
Currently, we have a vice president of community and government relations, Robert Ross, and he's in that position. And he's a great resource as well. But that would be the most.
The best place.
The best
Right.
place, yeah.
We've had Daniel Shea on also from Maureen's Haven, and he also is trying to, I see we're about out of time.
Yeah.
Daniel, this has been really a blessing.
Well, thanks for having me.
In so many ways, and I know our audience really appreciates the information that you're giving us here, and I wish you all the best.
Thank
and
you. Thanks
thank
for
you.
having me. Appreciate your
Thank you
time.
so much,
Thank you.
and this is a wonderful forum for you, and you're welcome back anytime.
Thank you.
So thank you.
Thank you.
And thank you so very, very much for watching us on this show. This is Jim Freddos. We'll see you again soon on The Radical Imagination, Real Talk in the Hamptons.